The assessment that I will be doing is assessing the thorax and lungs. Assessment includes posterior thorax and anterior thorax. The techniques that I will be doing is inspection, palpation, percussion, and auscultation. The equipments that I will be using is stethoscope, skin marker, pencil, centimeter ruler, or tape measure. Good morning, sir. My name is Regina Colleen and I will be your nurse for today. I will be assessing your thorax and lungs. This assessment is very necessary because it can determine the condition of your thorax and lungs. Before we start the assessment, make sure that you perform a hand hygiene. Make sure that you give clients privacy. Sir, I have some questions to you about your health history. Do you have a family history illness like cancer?
Yes, skin cancer.
Sino po yung may skin cancer sa inyo?
My grandfather.
Do you have allergies?
Don't have.
Tuberculosis, sir, do you have?
I don't.
Lifestyle, ano po yung ginagawa nyo? Anong habit nyo po every time, every day?
Nag-gym ako and nag-vape din ako.
Okay. Any medication being taken? Anong mga gamit nyo po na iniinom?
Wala naman.
Current problems such as swelling, cough, wheezing, pain, may nararamdaman po ba kayong ganun?
Heartburn.
So, first assessment that I will be doing is assessing your posterior thorax. Sir, can you stand po? Inspect the shape and symmetry of the thorax from the posterior and lateral views. Compare the anterior diameter to transverse diameter. So, inspect. Front, back po, sir. Okay po. So, the result is thorax is symmetry. Next is inspect the spinal alignment for deformities. Okay. The spine is vertically aligned. Next is palpate the posterior thorax. The findings is uniform temperature and no tenderness and masses. Next is palpate the chest or vocal tactile firmitus. You can use one hand or two hands, but I will be using two hands that are placed simultaneously at the corresponding area. Sir, while I'm doing the assessment, can you say blue moon or 1, 2, 3?
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
The next that I will be doing is percuss the thorax and percuss the diaphragmatic excursion. Sir, I'm going to percuss your back for diaphragmatic excursion. What I'm gonna want you to do is to take a deep breath and let it out, and then hold it. I will do some percussion and take another deep breath and hold it, and I will percuss it more. So, let's do it, sir. Take a deep breath and let it out and hold it. Take another deep breath, sir. And hold it. And let it out. So, as I measure that it comes to be 5 centimeter, which is expected amount of diaphragmatic excursion. Sir, the next thing that I will be doing is to auscultate the chest, your chest, using the flat disc diaphragm of the stethoscope. So you need to inhale and exhale, sir. inhale, exhale. Next is assessing your anterior thorax. So, inspect the breathing pattern. Inhale and exhale. Okay. So, yung breathing mo po is quiet and effortless. Inspect the costal angle and the angle at which the ribs enter the spine. So, sir, your costal angle is less than 90 degrees. Then next is, I will palpate your anterior chest and for respiratory extraction. So, it's normal. Next, I will palpate your tactile firmitude in the same manner as the posterior chest. Inhale. Exhale. So the next is I will percuss the anterior chest systematically. I'm gonna place my finger over your spot, then I'm going to tap my fingers, and then it's set up sounds that I can hear, and what can help me is your lung tissue is normal, and also tells me if there's other abnormal growth in your lung tissue. Then the next thing, sir, that I will be doing is auscultate your trachea. Then next is auscultate your anterior chest. Inhale. Exhale. Inhale. Lastly, document all the findings in the client's record.